In the name of Allah, the most merciful, the most compassionate, we are going to discuss together one of the common diseases that is starting to be very common in these days and very popular, especially among women. This disease is a syndrome or many symptoms together causing this pain and tingling sensation in the hands. The patients complain of painful hands and some paresthesia or tingling sensation on pins and pricks in their hands, and they complain of this especially in the evening while they are going to sleep. Sometimes they are awakened by the pain of their hands during their sleep, and then they feel that their hands are not as delicate or as sensitive as before. The hands are sluggish. They don't do the fine movements. They can, for example, thread the needle. They can't have a good grip of things. Sometimes the objects are falling from their hands. They can't carry things. So all these complaints, the patients come, especially the ladies, about 45 years or 55 years, something like this, and have this complaint. What caused all this story? Sometimes this is due to, of course it is anatomically, it is due to the tightness of the carpal ligament, tightening the carpal tunnel or the canal that the a nerve passes in. This nerve is called the median nerve, and its distribution is in the hands of the patients. So, due to tightening around the nerve in the canal, the symptoms come. Why? How does this happen? It might happen due to, for example, increased pressure in the canal itself, due to excessive fluids, body fluids, and the body fluids make some fluids in the canal itself more, and this entangles or entraps the nerve inside the canal. Sometimes it is due to trauma, post-traumatic, and this trauma could be an acute trauma, or it could be a repetitive, habitual trauma due to working hardly with the hands and so on. Sometimes it is due to an old rheumatoid arthritis, that's famous disease, the collagen disease, which affects the joints of the body, and when it affects these joints nearby the wrist, then the median nerve is interrupted in the canal, and we have the carpal tunnel syndrome. So, whatever the cause, we have an interrupted nerve inside the canal, which is giving all these symptoms. The problem of this disease is in its diagnosis, because it has to be diagnosed well, because the treatment is drastic. It is almost surgery. So how we diagnose this carpal tunnel syndrome? The patient comes with the pain and tingling in her hands, and then the doctor's clinical tests to have a wide idea or a rough idea about the diagnosis, and then he suspects the carpal tunnel syndrome. He refers it to further investigations. We know that the nerves work through electric charges running over these nerves, and the conductivity of the nerve is parallel to the viability or to the normal physiological work of the nerve. If the nerve is not working well, if it is biologically not on the standard, then the conductivity of electricity in the nerve is decreased. So we do what we call nerve conduction velocity. We put some electric stimulus in the fingers, for example, and we pick it up on different points in the arm, and through some computerized calculation systems, we can say that the impulse of electricity runs in this nerve in the normal speed, which is about 50 meters per second, or it is slow and it runs slowly, which means that in some point there is a kink or an obstruction. We can define the point of kink or the point of interruption by these tests, and we can know exactly that there is most probably a carpal tunnel syndrome in this point. Also, there is another test called the latency test, which is the milliseconds that the electricity has to build to start the impulse running in the nerve. And also, if it is longer than usual, then this means that the nerve starts to act slowly and not as it should do. After we do these tests, then we have to live with the disease. This we can do by splints, which puts the rest in some extended position, semi-extended position, and some analgesics and so on. But we also can give some diuretics. The diuretics, they decrease the body fluids and the fluid inside the carpal tunnel itself, and the symptoms are less. As we said in the start, that there is an increased fluid tension inside the carpal tunnel, and so if we decrease this level of tension of the fluid, which means that if we decrease the fluids inside the carpal tunnel, which is also means that if we decrease the fluids inside in all over the body, then we shall minimize the pressure over the nerve, and we shall have a good alleviation of the pain. How we can do this? We can do this by two ways. First way is to have some medicines that cause diuresis, which is the diuretics, and this will bring us to a case where we have also some complications like hypotension and so on. The other thing is to limit the intake of fluids, which is the thing that we do in Ramadan. In Ramadan, we are fasting all the day. We are restricting the fluid intake, and so the fluid inside the body are less during the day, and so we have alleviation of the pain. If we have also to restrict the salt, then we shall have it less and less fluids in the body, and then we shall have less and less pain. But anyway, the most drastic measure and the most successful measure is the surgery, because it is a mechanical disease. There is something pressing over another thing. If you just cut it and relieve it, then the patient is relieved. And this is the disease which the patient comes after treatment, after the surgery, and says, I am okay now. Just it is an on and off disease. If you do the operation, then you are in the best position. Doing the operation is taking about 4 or 5 or 6 days after the operation. The patient is not using his hand properly, but after that he will use it. And the patient is not hospitalized. The patient just go and stay in the hospital for an hour or so, and the operation is done, and he goes home, and that is it. So it is a simple operation. Like if somebody is seizing the neck of another person and he takes his hands off, then it's okay. That's the same story. In fact, the disease is called strangulation, which means that we are holding the nerve, and then if we leave it, then the patient will feel no pain. In Ramadan, all the patients that suffer from the carpal tunnel syndrome will enjoy some improvement, thanks to God for this, especially because this disease is now becoming very, very popular among women, and perhaps because it is well diagnosed and better diagnosed than before, and that's why it is discovered early, and that's why it's treated, and the patients are in a very good position. Thanks to God, and Assalamu alaikum wa rahmatullahi wa barakatuh.